This program is brought to you in part through a grant from Integrative Therapeutics. When results matter, you've made the right choice with ITI. The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. This week, the American Health Journal presents a special report, Discoveries in Alternative Medicine, with your host, Roger Cooper.
Hello and welcome to the American Health Journal special report on Discoveries in Alternative Medicine. I'm Roger Cooper. Our program today focuses on naturopathic physicians, doctors who are trained in the art and science of natural medicine. Although it almost disappeared in the mid-20th century because of the popularity of drugs and surgery, naturopathic medicine is making a comeback as a natural, vital part of the healthcare system. On today's program, we'll look at how naturopathic medicine plays a role in everyone's health, from birth to the golden years. First up, I'll look at naturopathic family medicine. Later, pediatric allergies and asthma can make it difficult for a kid to be a kid. Reporter Laura Windsor talks with a doctor who offers a different treatment plan. Then we'll meet a naturopathic doctor who created a gold medal award-winning healthcare program to save employers money and create a happy, healthy life for employees. Also, menopause, long regarded as a diagnosis. We'll talk with a doctor who says it should be celebrated as a part of life and will tell us how to make it great. Then, maintaining optimal health throughout our life. We'll talk with one of the authors of a textbook on natural medicine. With a focus now on the family, we talk with Dr. Carl Hanji-Bauer in San Francisco about how naturopathic family medicine is just what the doctor ordered.
First of all, naturopathic doctors are trained in family medicine right from their first year of medical school. We're a general practice field. We're trained to help people learn about their health, improve their health, prevent disease, and treat any disease that they may have. And I think what naturopathic doctors do that may be a little different than conventional family medicine is that we spend a great deal more time with our patients, helping educate them and helping them recognize how they can improve their health without the doctor in the room. So it's not just about giving them a prescription or giving them a vaccination or something along those lines. It's about helping give them tools so you can get them started in a direction and let them follow through in ways that they can improve their health on a daily basis.
The great thing about starting to get care from a naturopathic doctor is that it's allowed me to educate myself. And as a mother, and I'm sure many other parents will attest to this, when your child becomes ill, we are the first person to provide care. So it's pretty critical that we have some really good strategies right at hand to make a decision whether or not we need to even see a doctor and to know when is it time to go. And taking care of my own health has really empowered me to have a variety of things that I can do when my daughter gets a fever. What should I do? What kind of food should I give her? What's the homeopathic remedy? My daughter coughs at 12 midnight. I know what to do. I hadn't really heard about homeopathy until I saw Dr. Hanji-Bauer, and he hasn't actually given homeopathy to my children. They're the little remedies that you see at your health food store, little blue plastic tubes with all sorts of different names on them, and they're very inexpensive. And by showing me how to use them for myself, now I have a book that's kind of just a handbook for moms that if your child gets a cough or a runny nose or a pinched finger, I have a handbook and a little homeopathic first aid kit in my house that I would use. And without having been educated about this through my own care, I don't know that I would be as effective caring for my children. And my second daughter has never been to a doctor, and she's 2. She's never been ill enough that I've had to take her to a doctor. So it really goes back to the idea that naturopathic medicine is about wellness. I made myself into a person with optimal health, and that is my goal for my children. And because I have a doctor that empowers me, I have the tools to do so. And I'm really grateful. My husband has been to him for a sore throat, and it's amazing. I think antibiotics can be helpful in the right situation, but it's really great to know that Dr. Hanji Bauer allows us to question, do I really need this right now? I will take it if I have to, but do I really need to? And that he'll listen to our concerns and he'll help us make an informed decision, and we'll make that decision together. And if he gives us his expert opinion that it's necessary, well then we'll certainly appreciate that he has the credentials to do so, but appreciate also that he has the presence of mind to allow us to participate in our own care.
It's a fundamental tenet of naturopathic medicine is to teach. And to teach isn't just to hand someone something or to give them the right herb or to give them the right vitamin. That is certainly something we strive to do. But more importantly, we want people to be active participants in their health. And to do that, they need to be pointed in the right direction. They need to know what kind of insights will help them improve their health, help them manage a chronic condition that they've been wrestling with without relying on whether it's a medical doctor or a naturopathic doctor or any other practitioner. It's about helping them navigate so they can be active participants in their own health.
I think it's really important that patients know that they're going to be encouraged to participate. And after spending maybe some frustrating years or months going to different kinds of medical doctors and maybe not getting to the point where you want to be, it feels like you want to do something more. You want to expand your options. That is the time to go to a naturopath and say, okay, I'm going to participate in some new ways of feeling better.
Now with a report on pediatric allergies and asthma. Here's our reporter, Laura Windsor.
For many children, allergies and asthma make it more difficult to simply be a kid. Dr. Matthew Barral explains how naturopathic medicine is offering an alternative to conventional treatments with great success.
Allergies and asthma have plagued humankind for many, many years, and unfortunately our medical management of those conditions have really been just purely symptom treatment, without addressing what is causing the allergies or the asthma. Asthma has certainly an allergic component to it, and when I have a patient with allergies or asthma, I try and make sure that we address all parts of their life so that I understand what they're possibly getting exposed to, what they're eating and what they're drinking, and what their lifestyle is like, and that will help me really get to the main point of what's causing this underlying inflammation, which is asthma and also certainly a component of allergies. Conventional treatment really focuses on some basic categories, which are steroid treatment, bronchodilators, and immune modulators. And unfortunately, what we've seen, even with the advent of all these new medications, asthma rates continue to rise. The hospitalizations have certainly gone down because we've learned how to medically manage severe cases, but we're not controlling the rates of asthma. And the medications that we've been using in conventional medicine are simply just treating the symptoms. So from a naturopathic approach, again, we're looking at diet and lifestyle and vitamin and mineral status, emotional factors. All of these can affect allergies as well as asthma. And by treating those underlying symptoms, we can really take care of what is causing the inflammation, and the inflammation is what is the cause of the symptoms that we see. There is no typical patient, but there are typical conditions. No patient is going to react to the same treatment as the next patient. It can't just be a protocol-based medicine. They want to look at naturopathic medicine as something that they can put into a protocol and actually use those protocols for patients, but it doesn't work like that because naturopathic medicine is very individualized, and again, it's only typical conditions, but every patient is different. We had a 5-year-old with seasonal allergies, and patient had chronically been waking up with a congested nose and itchy, runny eyes, and came around every season, every fall time and springtime when everything's blooming here in Arizona. Looking at that child's diet, looking at homeopathic medicines that will be very specific to him as an individual, and looking at certain vitamins and minerals that we know are deficient in children that have allergies. We were able to treat this child and their symptoms decreased by a large amount, and now the child virtually needs no allergy medication during the heights of the allergy season. It used to be that naturopathic medicine was the traditional approach, and now it has somehow become the alternative or complementary to conventional medicine, which is actually quite backwards. I see naturopathic medicine as expanding to something where we are really the primary gatekeepers to medical care, because by treating the root cause of all illness, we prevent long-term issues. Things like heart disease and autoimmune disease and arthritis. All of those can be prevented even at childhood, and naturopathic medicine has an opportunity with the amount of time that we spend and with the understanding that we have of the patient as a whole to really prevent those things from happening later on in life.
For Discoveries in Alternative Medicine, I'm Laura Windsor.
With the rising cost of medical insurance, many companies are feeling the pinch. Dr. Bernie Noe of Green Mountain Wellness Solutions in Montpelier, Vermont, created a program for the Vermont Automobile Dealers Association, a program that's won the Vermont Governor's Gold Medal Worksite Award for the past 3 years.
Well, the thing about most programs, most any program, is that they're very naturopathic in design, even if the people that design those programs don't even know what naturopathic medicine is, because what is naturopathic? Well, what are some of the basic principles of naturopathic medicine? To focus on prevention and education, and to use the least invasive techniques possible. And those are the core elements of any good wellness program. But it's the way our program differs is mostly in the information that we deliver in the course of our programming. So an example would be when an individual is identified to have high blood sugar. Instead of just sending them to a dietitian and saying just eat less sugar and make sure you get this many exchanges of different carbohydrates and take this medication such as metformin for your high blood sugar, we sit down with people and help them make changes with diet and physical activity primarily around typically what's called a low glycemic eating plan. So we not only reduce sugars, we reduce grains, we reduce potatoes, we increase fruits and vegetables. You can think of it as a modified Mediterranean diet. And it's extraordinarily effective. A recent study that I was just reviewing last night, they found a 40% reduction in the number of individuals with metabolic syndrome over a 12-week period using an intervention like this. Metabolic syndrome is a precursor to diabetes, and one of the elements of that is high blood sugar. So heavy focus on physical activity and dietary modification and counseling. We don't just give somebody the results at a wellness screening and send them out the door. We actually talk to them about what those results mean and the changes they can make and why they would want to make those changes to help them get well. There are about 2,000 employees that are eligible to participate in this program. And one of the things we're most proud of is that for the last 3 years in a row, the Governor of Vermont has recognized this program by awarding it the top Worksite Wellness Award for large businesses. We're very proud of that. The second type of outcome we look at are clinical outcomes. So we show up every year and we measure things like blood pressure and cholesterol and height and weight and so on. And so we can measure changes over year from year to year. What we found is that in the first 3 years of this program, there has been a 30% reduction in the incidence of high blood pressure, a 36% reduction in the incidence of multiple risks for heart disease, a 32% reduction in the number of individuals who are physically inactive, a 50% reduction in individuals who are depressed, a 12% reduction in those who have excessive stress levels, and so on. Those are a few examples. Third area we look at are financial outcomes. And we estimate that in the first 3 years of the program they've saved $660,000 in terms of direct medical costs, just shy of $1.2 million in terms of indirect medical costs, things like decreased productivity, absenteeism, workers' comp, disability, that are related to these health risks, for a total savings of about $1.8 million. And that's been a return on investment for them of $9.20 cents saved for every dollar invested in the program. The fourth area we look at are actual healthcare claim changes. And in the 3 years immediately prior to the program inception, they were having their healthcare costs were increasing by an average of 19% a year. In the 3 years since program inception, it's been 3% a year. And the last area that we look at is really the human side. And this is where we hear some of the most dramatic stories. And I'll just give you one example. An individual at a dealership in Montpelier, Walker Motors, very first screening he went to identified that he had high blood sugar. So we talked to him about what that meant, what he could do about that, and we told him he really needs to go see his doctor to confirm that he in fact has diabetes and get more assistance with that. So he did that, and I talked to him a few months later. And he told me that his blood sugar is now controlled with medication and physical activity. And he joked with me that he's his wife's new pet. She takes him on walks every night. And he said, you know, if I hadn't done the screening, I never would have known that I had diabetes because I didn't feel sick and I didn't go to doctors. And he told me that about the same time his brother, who also has diabetes, had just lost his eyesight from the diabetes. So he was feeling like he had just dodged a major bullet by finding out about this and making those changes early enough to have an impact.
And now a Discoveries in Alternative Medicine quick quiz. Which of the following can help reduce bruising from an injury? Homeopathic arnica gel, applying rubbing alcohol, running the bruise under warm water, or applying pressure to the bruise? Your answer next. You're watching the American Health Journal presents Discoveries in Alternative Medicine. Which of the following can help reduce bruising from an injury? Homeopathic arnica gel is very effective at reducing bruising, pain, and swelling of topical injuries. Rubbing alcohol in warm water will not change a bruise, and applying pressure to the bruised tissue may increase the bruising.
Dr. Holly Lucille of Los Angeles is the author of Creating and Maintaining Balance, a woman's guide to safe, natural hormone health. She says menopause should not be treated as a disease or a diagnosis, but should be celebrated as a natural part of a woman's life. We ask her about the naturopathic approach.
Menopause is a very natural stage in a woman's life when it comes to the end of her ability to be fertile and give life, to have birth. But it's a very extraordinary stage because there's a whole lot more to come. So some people think it's the end of her ability to give life, but it's the beginning of a wonderful stage of her life that's more geared towards a mental and more intuitive nature. And most women live half their lives living in menopause, so it's something really to be celebrated. Menopause in a conventional sense has been deemed a diagnosis, which I think is an error. There's nothing wrong with the woman reaching menopause. It's not that they're sick and that they need to be treated. It's that this phase needs to really be understood, and women who are going through it need to be supported, honored, and cared for. In naturopathic medicine, what we do is honor that transition, understand that it's a huge transition. There's a lot going on. It's a huge endocrinological shift, so hormones are shifting. It's a mental shift. It's an emotional shift. There's spiritual shifts. And there are different influences in our modern day society that are having that change be quite difficult. So we need to understand what's influencing that change in our modern day society, support the adrenal glands, which are the built-in backup system for postmenopausal hormone production. Also making sure you're supporting organ systems, making sure the liver is functioning properly. The liver is responsible for excreting spent hormones. And so the other thing that you want to do in naturopathic medicine when a woman is transitioning to menopause and having symptoms is offer safe, natural symptom relief. That means not only identifying and treating the cause, so understanding the influencing factors, the xenoestrogens in our environment, or adrenal health, but also addressing acute concerns, because women are uncomfortable. And so making sure you've got safe, natural support, safe, natural symptom relief. And there's many things that can do that.
Well, today I wake up, I feel energetic. I wake up and I don't have aches and pains. I know a lot of people that I'm with throughout the day, or let's say at the gym or what have you, and they talk about, oh, you know, I get up and this aches, and they start talking about ailments. And I look at them and I go, I don't want to be one of them. I want to get up and feel great. And I do. And so that's, I think, the impetus for going to see Dr. Lucille was, I want to be that energetic, alive, vital, athletic person. and not the one who sits around and kind of moans and groans about, well, you know, when you get older, everything falls apart, and it's all downhill from there. And I just didn't buy it, and I didn't want to buy it. So I thought, I just don't want to do that. I want to do something better for myself.
In naturopathic medicine, when you're caring for people, caring for women going through menopause, one of the most important things is to treat them as individuals. Everybody's having a different experience, and we're governed to use the least invasive methods to diagnose and treat. And one of the least invasive methods to diagnose is to actually listen to someone, to actually hear and understand her experience so you can adequately understand the journey and how to support her through that. It's a very introspective process, and introspection is important when you're going through, it's literally like a cocooning process. But in our modern day society, we might confuse that as depression, and so throw an antidepressant at it. Or, there's a decrease in libido because it's naturally the biological end of having the ability to give birth. So there's a natural law in the libido. Instead of thinking that my libido's low and there's something wrong with that, honor what your body's going through, being able to be in touch with it, not pathologize it, but understand it. I think that's the most important thing.
This program is being brought to you in part by a grant from the American Association of Naturopathic Physicians. For a referral to a naturopathic physician in your area, go to www.naturopathic.org.
To learn more about maintaining an overall quality of health throughout our lives, we talk with Dr. Michael Murray, co-author of a textbook on natural medicine.
Americans have been sucked into the belief that they can solve all their problems by taking a simple pill. The truth of the matter is that many of these pills simply mask the symptoms, fail to address the underlying cause, and as a result, the disease is able to progress, as well as many of these drugs cause serious side effects. If you really look at the conditions that most Americans are faced with, they're related to diet, lifestyle, and psychological factors. Those are things that conventional medicine has very little answers for, while naturopathic medicine provides great answers. One of the big conditions that is affecting millions of Americans is diabetes. When people are diagnosed with diabetes, most often they are prescribed a pill. The pill will keep the blood sugar levels down for a while, but eventually the pill stops working, so the doctor has to prescribe either more pills or higher doses of the pill. And when that happens, serious side effects occur, and studies have shown that when people go that route, there is a shorter lifespan. They will actually die sooner than people who had uncontrolled diabetes. Now, we don't want people to be uncontrolled with their diabetes. We want them to be under the care of a naturopathic physician or medical doctor who will address the underlying cause. For most Americans, that means changing the way that they eat, changing their lifestyle, and utilizing natural products to help regulate their blood sugar levels.
So what is the best natural approach?
It would be nice if everybody was the same. One treatment would work just as well from one patient to the next. But the reality is that we all have biochemical individuality, we all have different personalities, and we all respond differently to medications as well as supplements. So an individualized approach is absolutely necessary for good medicine. One of the things that's very important in naturopathic medicine is education. And many times it's just telling the patient what they already know. It's impossible for people to be healthy if they are following an unhealthy lifestyle. If they're smoking cigarettes, if they're drinking too much alcohol, if they're not exercising, if they're not getting enough sleep, if they're engaged in harmful health habits, they're going to be unhealthy. So naturopathic medicine will approach that patient first by helping them realize that they need to make some changes. Now, changes sometimes are very difficult for people, but when they understand the importance of making those changes, they're moved to make them. Naturopathic physicians are trained in helping people make change. And that's really one of the key aspects of why our medicine works so well, is because we help people make those changes that they need to make in order to be healthy. Our natural state is health. We just have to eliminate those factors that impede or impair our ability to heal. I think there are three key supplements that should be part of the foundational approach to good health. One is a high-potency multiple vitamin and mineral formula. Vitamins and minerals, they work in our body as components of enzymes. Each enzyme in our body, and these are compounds that either break down other molecules or build other molecules. So enzymes make us alive, and each enzyme has two arms. One arm holds a vitamin, the other arm holds a mineral. So we have to make sure our body has a constant supply of these essential nutrients, vitamins and minerals. So a good high-potency multiple vitamin and mineral formula is a good nutritional insurance program. Next, we have to take advantage of plant-based antioxidants. There are so many beneficial effects by increasing our intake of plant foods, and we can also achieve similar benefits by taking concentrated forms of plant foods like green algae products, spirulina, chlorella, wheatgrass juice, barley grass juice, as well as flavonoid-rich extracts like grapeseed and pine bark. The last supplement that I think everybody should be taking is a high-concentrated, pharmaceutical-grade fish oil. These omega-3 fatty acids that are in fish oils are very important to the health of our cells. High levels of these omega-3 fatty acids in the diet or through supplementation is associated with nearly a 50% reduced risk of having a heart attack or a stroke. These omega-3 fatty acids exert significant anti-inflammatory effects, and they also are very important for the functioning of our brain. Of all the nutritional products, a good, high-quality, pharmaceutical-grade fish oil is probably the most important.
Thank you for joining us for this American Health Journal special report, Discoveries in Alternative Medicine. For more information, call 800-303-3200 or go to thedoctorshow.com. For Discoveries in Alternative Medicine, I'm Roger Cooper.
This program is brought to you in part through a grant from the American Association of Naturopathic Physicians, representing naturopathic doctors, physicians who listen.
If you would like to order a tape or a DVD of today's American Health Journal, please call us at 1-800-303-3200.